everyone. Thank you AS for this opportunity. This is a study of stage 4 NVG in PDR to assess the efficacy and superiority or the equivalence of single step versus two step procedures in cases of stage 4 NVG in PDR. In stage 4 NVG, the fibrovascular proliferation causes closure of the anterior chamber angle. NVG in PDR contributes to approximately 21% of the cases. It is usually bilateral and more commonly seen in type 1 diabetics. Patients present with raised intraocular pressure, corneal edema, NVAs, and the closed angles. Besides treating the systemic disease, the main aim is to reduce the inflammation and the IOP, which can be done by treating the underlying cause, that is the ischemia, which holds true even for the principal in management cases of the stage 4 NVG. But the challenge is that in spite of the maximum treatment, in maximum cases, the IOP does not come down, and because of the more inflammation and more IOP and corneal edema, you cannot treat the major cause to reduce the VEGF surge, that is the lasers. And in this time, the IOP remains high and it causes the damage to the optic nerve. This study shows the overall success rate of 61% at 6 months. This showed the average success rate of 67% at 1 year and 61.8% at 3 years. While this is a case of the combined procedure showing the complete success rate of 52.9%. This was the subsequent two-step procedure. While in this combined procedure surgery, they showed the success rate of approximately 100% at 6 months. This article of the PLOS One showed that if the trap fails, there are more chances of needing a vitrectomy in such eyes. So the aim of our study was to compare the success between two-step approach and the single-step approach in cases of stage 4 NVG secondary to the PDR. It was a prospective interventional study. The patients were divided into two groups and the exclusion criteria are illustrated here. In group 1, after controlling the IOP, the patients underwent pan-retinal photocoagulation followed 2 to 3 weeks later by trabeculectomy and MMC preceded 3 days before with the intravitreal bevacizumab. While in group 2, patient was directly taken for the combined procedure preceded by the intravitreal bevacizumab. This surgery shows the phonics after creating the phonic big conjunctival flap. The MMC soaked sponge was kept for the 2 minutes. Partial thickness 4 mm by 4 mm scleral flap was created. Kelly sponge is used to create the inner window. Scleral flaps were sutured. After this, the thorough 23 gauge vitrectomy was done and the lasers were done up to the ora serrata. Similar steps were done in the group 1 except for the pars plana vitrectomy. Now coming to the results and discussion. These were the statistical methods used in our study. This chart shows the descriptive statistics for demographic and clinical parameters of the patients in both the groups. When we compare the ocular parameters, if we see a intra-group, there is statistical reduction in the IOP over the 6 months period of time in both the groups. But if we look between the groups, the IOP reduction at 6 months was 20.5 in group 1, while it was 26 in group 2. The number of AGM needed at the 6 months was 1.5 in group 1, while it was 2.13 in the group 2. So the reduction was 1.38 in group 1 and 0.88 in group 2. If we see the visual acuity, the change in visual acuity was 1.13 in group 1, while 4.38 in group 2. The 4-line improvement was seen in 5 cases in group 2 compared to the 1 in group 1, while we could save the disc in 7 patients in group 2 and only in 4 cases in group 1. This all concludes that because of the intervening period in the group 1, the IOP remained high, which causes the further damage to the disc. These were the transient complications which were seen and were comparable between the two groups. When we compare the type of the success achieved, there was no difference in complete and qualified success between the two groups. The KM plot shows showed the early and sustained reduction in the IOP in the combined group. To conclude, the results, if we see, the gain in vision in combined group was 4.38 compared to the trabeculectomy group, while the mean reduction in combined group was, the mean IOP was 17 mm, while in the trabeculectomy was 22. Need of AGM post-operatively in combined group was 0.88 compared to 1.38 in the trab group, and the cumulative success rate was 100% in the combined group, while we have 2 cases of trab failure in the two-step approach group. No significant differences were seen intraoperatively in any of the groups. These are few pre-surgical slit lamp and fundus photos and the post-surgical pictures of the patients. To conclude, despite treating the strict systemic control and early treatment, even we can salvage the vision with the timely and aggressive management. In our study, the single-step combined approach was found to be more effective in controlling the IOP with better visual outcomes. The limitations is the small sample size and 6-month duration of the follow-up. Thank you.
Statistically, there is no significance between the two groups. It is only just a feeling and the number is very small.
No, so statistical difference, we have...
P-value is never below 0.05.
Yes, sir, because of the small sample size. But if we see the number of the reduction in the AGM post-operatively or the amount of the reduction in the IOP, it is more.
But that is by chance. That could be because of chance. Unless until statistics proves it, we cannot say.